So people who are going to have a buildup of this dampness are also going to be people. Western medicines often produce dampness to try to control the symptoms that a patient may have. So, um, so our food supply often produces dampness. So Americans tend to be very damp.
Zooming back out to the global situation, I wonder if there's anything you can share about the pandemic, a pandemic, or pandemics from a CCM perspective, from a Taoist perspective, or even specifically, we can get more technical for this part. That's fine. Even the movement, the particular flavor of this pathogen, the way it manifests for us, and I'll add one more thing to that, which is the way we would look at it from a Chinese medicine perspective, when we see the way that the pathogen affects the lungs, creating that hyperinflammation, creating a ton of dampness, inability for the body to clear that, and just some of the, acknowledged pre-existing conditions from the Western perspective. Like, we know certain people are more susceptible to that, and I wonder how we'd look at it from classical Chinese medicine perspective. Is that too big of a question?
Yeah, there are a lot of words there.
We can break it out. We can start with like sort of global pandemic and look at that. Yeah. What's going on there?
So the Wen Bing school of thought, which is the school of thought that Chinese medicine created to deal with epidemics, goes on to say there are multiple reasons that will cause a pandemic. One would be a change in the food supply. One would be an increase of travel. One would be war. One would be change of lifestyle. These are the kind of factors that make. So basically, they're saying that the human being, when it's put into a new environment, and that these things create new environments for the human being, that a pandemic becomes ripe. And so when we go through that checklist, we have that, right? We have artificial lights, we have artificial heating, we don't necessarily go to bed that much anymore.
And the travel, the travel is a big one. That's
right?
Super interesting.
Yeah, traveling is nothing these days. Food supplies have totally changed. We have people who are being propped up by Western medication for longevity purposes, right? So we have all these things that, according to the school of thought, says that we were ripe for a pandemic, right? And so according to that school of thought, no, not much of a surprise that we're here, and overpopulation is another one. Overpopulation will also spawn that on. But anyhow, so I don't know where to go next here.
No, but it's just interesting to have that context for
right.
It's right there.
And so it's very interesting. I think, when we first were aware of the coronavirus outbreak, it was the elderly were going to be hit hard. But I think there's data suggesting that it's not quite that uniform. I think it's going to hit a bigger wake through the population, and that more people are going to be vulnerable to this and than other people suspect. Now, this particular pathogen is going to produce a huge amount of inflammation in the system.
Mhm.
We call it heat, they call it inflammation. It's going to produce all this, and the body's going to have to deal with that. And the body's going to use whatever resources it has on hand. So each body has different resources. So you're going to find somebody who's got a lot of damp is going to they're going to try to use that damp to try to control this heat, which is going to be a huge complication. And these are my guess of the people who are faring probably the worst.
Yeah, I mean, just to interrupt you, just because I want to just try to add additional language to it, because I think
Oh,
someone can follow us from uh, right there, which is we're getting a lot of heat. What could be termed as looked at as inflammation, and then I think someone who has a lot of dampness being more susceptible. I'll let you kind of explain that, but I think that's accurate because you look at the comorbid conditions as individuals with hypertension, individuals with diabetes. I mean, those are conditions that we would look at as the Chinese perspective is there could be a strong damp component to those.
right. Well, and you, so let's define dampness.
Right.
Dampness is you can think of it as kind of a byproduct of inefficient metabolism.
Hmm.
And it kind of produces this byproduct tends to be kind of mildewy. So think about how tough it is to get mildew out of the bathtub. It's tough. It takes time. It takes a persistent effort to remove this dampness. Some people say it's stubborn. And so people who are going to have a buildup of this dampness are also going to be people Western medicines often produce dampness to try to control the symptoms that a patient may have. So, um, so our food supply often produces dampness. So Americans tend to be very damp. And I think that's why, even like when you look at Italy, they had such a higher death rate is the increase of dampness in the population.
Interesting. That's super because it's
Right.
not necessarily a population that has a lot of dampness in general. Is that where you're going with that?
No, I'm saying that you probably look at the average elderly person in America and compare their
Yes.
death levels to that of the Chinese population,
Yes.
we're going to be a lot higher in dampness. Generally speaking, they eat more vegetables. They have less damp. They cook their vegetables. So I don't know if Italians cook their vegetables. I don't know enough, is what I'm saying.
Hmm.
But I'm not surprised. I wouldn't be surprised if the American death toll is higher than the Chinese death toll.
Hmm.
The cultural relationship with dampness.
That's very interesting. The cultural relationship to dampness. So in populations, right? I think there's two parts to that. One is populations that might already have a lot of general dampness, and then populations where that might not necessarily be present, but that are suddenly sort of confronted with it. Do you think that can be harder on the system, or it's harder on a system that is already dealing with? It's probably harder on the system of uh, people that already have excess damp, or as we would call it, perhaps an inefficient metabolism. Um,
Right. So yeah, I so because it goes two ways.
mhm.
One, the individual's immune system is so strong and so quick to respond, they just burn up. Right. We often see this with epidemics with children.
Yes.
Right. Um, in this case, we're going to see someone who isn't strong enough to produce a long-term fight. So they will succumb because they don't have a military to wage a 20-year war.
Hmm.
So if they can't fight the thing in the first 2-3 weeks, doesn't look good. And so dampness is going to be
Well, let's give
but it implies that there's an underlying deficiency.
Mhm. And at the same time, let's go back to this idea of our body producing or our body producing inflammation as a response to the infection, and
Right.
the dampness being almost a byproduct of that or a necessary component of that, so that we don't what we would look at as burn up, or we don't produce excess heat. Is that a fair way to look at it, or it just kind
There's,
of buffers? It just kind of buffers that that heat that we need to create.
well, I think it's important to take a moment here and say that the Chinese don't use definitions, they use associations.
Interesting.
And so that question is more like a direct linear definition link. And what they're going to say is that it's going to do three or four things simultaneously. And it's not one or the other, they're all kind of happening.
Got
One is it's going to try to buffer that heat or that inflammation. Two is that inflammation is going to have a burning out sensation. So the dampness is going to apply a certain level of moisture, not ideal moisture, but the lungs still need moisture. So it's going to try to counter that mechanism at the same time. Two, you're also going to say that the dampness, on some levels, is trying to put the inflammation someplace. So it's creating like a jello mold to store it, which is a little bit different than buffering for me.
it.
But so the dampness is having multiple purposes that's going on. And again, we would say in a normal environment, we would say that it's not necessarily healthy, but again, we might say in this condition, it is the best the body can do, meaning that sometimes we do have to make choices that aren't ideal. And this is like going back to the lows, my house is on fire. You might be able to criticize me for not being fully present to all my emotions during that crisis, but that might be an acceptable means to get the job done. So the dampness might be something similar where we can try to do a bunch of stuff that's not ideal in any other circumstances.
Right.
House on fire is not a circumstance. And this inflammation is very much like a house on fire.
It is. Yeah. And we can land this plane a little bit because I want to be mindful of your time, but maybe perhaps one final thought here, as we so say the body fights off the infection. I think we see reports of and of course they're still few, and it hasn't been widely sort of discussed yet, but underlying lung damage. There's mention of perhaps individuals being severely compromised as a result of being intubated and being on needing that much support, the lungs themselves. And so we would look at that from the perspective of the lung yin being compromised. Would you agree? And
yeah. So I was able to get my hands on the herbal formulas that they use in China in February. And the recovery phase of the process after the person is recovering from the illness are very much lung yin, lung moisture building treatments. And we even have that with common cold, right? So sometimes,
yes.
you get over a cold and you have that dry hack for
Mm-hmm.
months, right?
Mm-hmm.
Call that the 100-day cough. And it's just this dry, unproductive cough that
It's stubborn.
talk too much, right? So even something like this could produce that. Just imagine something more severe kind of rolling through.
Yeah, that's one of my because of how stubborn that cough is. That's become one of my favorite building blocks for a formula in that sense. Qing Fei Tong, clearing heat from the lung.
Mhm.
And it's got the Huang Qin in there. It's got the Ban Xia and the Chen Pi. Help dry things up, move the qi a little bit. It's just such a wonderful formula, kind of descend that lung qi. But what a stubborn cough! I know exactly what you're talking about. I've had that, and I've just seen patients, suffer with that, or
Right.
um, they get that cold, they get over it. And as acupuncturists, we often see that, right? Like, sometimes we'll see them when they come in with the onset of a cold, but oftentimes it's like, oh yeah, I had it last week, and they're still, um, you know, struggling with that dry, unproductive cough. Yeah, it's got some wonderful yin, sorry, yin moistening. It's got some stomach yin, and I think that's an interesting concept that you've um, discussed before. That need for the stomach yin, um, both as a way, in the sense that it gets consumed, sure, as through the process of disease, but also as a fundamental component of our immune system, fundamental component of our immunity. And that might be an interesting way to wrap this up, is just talking about that from our perspective, how we look at the immune system, what we would call, um, what we would, I like what you said, we would associate with our Wei Qi.
Uh, well, the difficulty is that because that question opens the door to a more uh, uh, Chinese medical theory
Yeah,
that I'm not sure. I'm trying to figure out how we can do this in layman's terms without
that one might be
breaking
tough.
down
Yeah.
the functions of the organs and breaking into the thin and thick fluid systems and
Well, it might be that might be a longer. Well, you'll have to come back and talk to me about that, and we can do a whole. We can do a whole. That might be interesting. A whole immune
right,
system from the Chinese medicine perspective, and then that could be less, and that could be more technical, and we can go with that. That might just be interesting
right,
for more practitioners. But suffice to say, I mean, we would look at, um, this, and the stomach yin is playing an aspect in playing a function in our immune
right,
system. And I think one of the things that might be accessible for someone who's not familiar with with Chinese medicine terminology is, um, the idea that we associate, or we could associate the stomach yin with uh, perhaps gut health, which is acknowledged in Western medicine as playing a role in the immune system. And so I think that's interesting because of how much people are just kind of uh, yeah, reaching for different things that they can do to strengthen their immune system.
right.
So we would acknowledge that gut health plays a role if we look at it as
Yeah,
uh,
and I would say gut health here, particularly the microflora of the gut
yeah.
being important from. So we would say stomach yin, they would say microflora, um, and we can make that analogy so we could bridge the two worlds. Um, but yeah, exactly.
Yeah, that's a safe analogy to me.